Hand hygiene. Good morning, Mrs. O'Neill. How are you?
Good morning.
Morning. Well, my name's Sarah. I'm your student nurse. I'm here today to give you an intramuscular injection, okay?
Okay.
Okay, can you just verify your name and date of birth for me?
My name is Jennifer O'Neill. Birthday is January 2nd of XX.
And I see you have an allergy bracelet. Do you have any allergies I need to know about?
Ibuprofen.
Ibuprofen? Okay. And that's your only allergy, correct?
Yes.
Okay. And how would you rate your pain level today?
Like a 2.
Like a 2, and is that an acceptable pain level for you?
Yes.
Okay, perfect. And then just because of the medicine we're giving today, it is known to cause a little bit of some hearing problems. Do you experience any hearing problems on a normal basis?
No.
No. Okay, perfect. All right, Mrs. O'Neill, I'm going to go gather my supplies and I'll be right back in, okay?
Okay.
Okay. Hand hygiene on the way out. All right, now we're in the med room. We're going to check our order to see what do we have for the 0800. We just have her one intramuscular. We're giving it every 8 hours. We know this is appropriate. She has not received this medication yet. We make sure that we have Jennifer O'Neill's chart one more time. Date of birth 1/2XX. The only allergy she let me know about is ibuprofen, and that's all we have in the MAR. We already had an LPN go in and do all of our morning vitals, so we're good to go on that. And her pain is at an acceptable pain level, so we are ready to begin our intramuscular injection. Now we're going to move on over to our supplies. So since it's an intramuscular injection into the ventrogluteal site, I want to choose a relatively longer needle. I'm going to choose a 1-inch needle, which is going to be this. I'm going to inspect the packaging, make sure that it is packaged correctly, and make sure that the expiration is within range. Right here, 2/29/24, so we're good to go. So I'm going to put this aside along with my alcohol wipe and my gauze. Then I'm also has to choose my syringe, since that's just the needle. Intramuscular injection, we can administer up to 3 milliliters. So I'm going to choose a 3 milliliter syringe, and this is also appropriate given that we are giving 60 milligrams. So we need to give 1.5 milliliters. So that's going to be half the syringe. So that's a perfect syringe to choose as well. And then we want to choose our medication from the drawer. So here's my Gentamicin. It's a 40 milligram per 1 milliliter. And since we're giving 60 milligrams per 60 milligrams, that's going to be 1.5 milliliters. We're going to check the expiration is 10/20/23. So we know that this is good medication we're going to take with us. And then now we're just going to compare it to the MAR. So Gentamicin, 60 milligrams. This is 40 milligrams per 1 milliliter. So we're going to give 1.5 intramuscular every 8 hours. So we are good to go. We're going to grab all of our materials and we're going to head back into the client's room. Hand hygiene. All right, Mrs. O'Neill, I am back. Are you ready to go for your intramuscular injection?
Yeah, I guess.
Okay, so just to let you know a little bit about the medication, I have with me the Gentamicin. This is going to be your antibiotic. Okay? I'm going to administer it into the ventrogluteal site. So when it's time, I'm going to need you to just roll over onto your right side for me, and then I'll walk you through the process, okay?
Okay.
Can you just verify your name and date of birth for me one more time?
Jennifer O'Neill, January 2nd of XX.
Perfect. And I'm sorry I lied to you. I'm going to need you to do it one more time when we're ready to scan in the medication, okay?
Okay.
Okay. So let me just get all my stuff set up and then we'll get you moving, okay?
Okay.
So I'm going to hand hygiene, put on my gloves. And then we're going to, in the med room, we made sure that we looked at hospital policy, and we do see that we are going to have to aspirate with an intramuscular ventrogluteal injection, okay? So I'm going to get all my supplies ready. Got my needle. Throw this in the trash. Connect to my needle and do the OK method to uncap my needle. I'm going to place my needle on a sterile gauze. Here. Mrs. O'Neill, it's time to administer your medication. I need to scan it into my MAR, okay?
Okay.
Can you verify your name and date of birth for me one more time?
Jennifer O'Neill, January 2nd of XX.
And your allergy?
Ibuprofen.
Perfect. Ching. Now I'm going to come over here. I'm going to scan my medication. Ching. Gentamicin, 40 milligrams, 1 milliliter. 60 milligrams is going to be 1.5 milliliters. So we are good to go with our medication here. While I do my second check for my medication, I have gentamicin, 60 milligrams per 1.5 milliliter because we have 40 milligrams per 1 milliliter. Expiration 10/20/23. This is okay to give intramuscularly, and the every 8-hour range is within range right now, and it is 0800. So I'm going to draw air equivalent to 1.5 milliliters, inject into my medication, expel the air, tip over, and then I'm going to be withdrawing 1.5 milliliters. Right here, 1.5. I am expelling my needle, and I am inspecting for no air bubbles. Looks good. I have my medication in my needle. It's time for me to perform my third check. Gentamicin is in here. It is 60 milligrams, which is 1.5 milliliters. So I withdrew the black line right to the 1.5. It's intramuscular. We're going to be giving it in the ventrogluteal location at 0800, which is now. Every 8 hours is appropriate. She has not received this medication yet. And then we're also inspecting the needle. It looks not bent. And we know it's an appropriate size needle. It is a 1-inch 23 gauge needle, which is appropriate for the intramuscular injection in this site, as well as the syringe is a 3 milliliter, which is an appropriate size syringe given we are injecting 1.5 milliliters. And we're going to place my syringe on my sterile pad while I prep Mrs. O'Neill. So I have my alcohol swab. All right, Mrs. O'Neill, I'm going to need you to roll over for me. I know you have our bed rail raised, so you could just extend your one arm. You can extend your one arm over, and we're going to roll just like we've been practicing. Great job. Okay, I'm going to have to uncover you, okay? Might be a little chilly. Okay. Comfortable like this? Okay. Normally, Mrs. O'Neill would be adequately dressed, but for modesty's sake for the video, she's going to remain in her underwear. So I'm going to locate her greater trochanter, and I'm going to place my hand right there. I'm going to extend my pointer finger out and make a V. In between this V is where I'm going to be administering the injection. So I have my alcohol swab, and I'm going to clean this area. Now for the Z-track method, which I'm also going to be utilizing today, I'm going to be pulling the skin with the pointer finger to the side and holding it firm. Throw this in the trash. Pick up my sterile needle, inspect the needle, make sure it's not bent, and to ensure I still have my 1.5 milliliters, I'm going to use my dominant hand to hold the needle so I can dart it into my patient. All right, Mrs. O'Neill, you're going to feel a slight pinch, okay?
Okay.
Before I inject the medication, I want to aspirate to ensure that I'm not in a blood vessel and am into the muscle. I'm going to aspirate, no blood, that's perfect, and now I can continue my injection. Now with my hand here, I'm going to move my way up to the plunger since I'm still holding the skin firm. I'm going to administer it at 10 seconds per milliliter. So since we have 1.5 milliliters, it's going to be about a 15-second injection. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now that my injection is in, I'm going to Hold the needle here for about 10 seconds before withdrawing. When it's time to withdraw the needle, I'm going to withdraw the needle quickly at the same angle, 90 degrees that it was inserted. I'm going to release the skin, and I'm going to place light pressure with my sterile gauze. I'm going to activate my safety needle and put my needle into my sharps container. All right, Mrs. O'Neill, how was it? Just a slight pinch, right? All right, Mrs. O'Neill. Is there anything else I can get for you while I'm in here? We'll get you all situated in one moment. No? Okay. Throw these in the garbage. Hand hygiene. All right, Mrs. O'Neill, we're going to roll back over, okay?
Okay.
3, 2, 1. Great job. Okay, can get you all situated back here in bed. All right, here's your call bell. Let me know if you need anything else. We'll be back in to check on you soon, okay? Okay, gonna take all my materials with me, with my WOW. Hand hygiene on the way out. And then document that I have given the medication, initialing SE, site, retrogluteal. All right, Mrs. O'Neill is done.